good?
Yeah.
So I guess it's going now, right?
No, I don't know. It's starting.
I think it started.
I don't think it has.
I think it has.
Oh, there we go. There, now it's started.
Hey, everybody.
Hey, everyone.
How are you?
Happy Friday.
Yeah.
Yay.
Dave and Linda from Balance Point Health Center.
Yeah.
As always, at least we're here working, so that's the best part.
Yeah, so excited to hop on today, especially because we just finished our cleanse.
Thank God.
Yay, last Monday. And we had 25 people participating, in case you didn't know or if you didn't hear about it last week. And it went really well. So most people ended up losing weight, and that's just a nice perk. That wasn't really the goal. More energy, less cravings. And well, why don't you talk about how you feel?
Besides the blinding migraine with the nausea, wanting to throw up the first day because I didn't have caffeine, that was pleasant. I even had to try to play a game of cards with my kids when I came home, and I wanted to throw up on the cards. Then I went to bed.
I think you talked about that last week.
I know.
Yeah.
So then I woke up at 4 a.m. and I had unbelievable energy, and my energy's been good all week. So I've worked more hours, which means I'm now tired, and I really do want a coffee, and I probably will have one.
Really? So this is the first time he's craved it. So I was a little bit different. I actually only have a coffee a day usually, but I was craving my coffee like for longer than one day. Like I kind of wanted it for the first 3 days, but then by day 4, I started to feel more balanced. So everyone's different, but everyone got rid of their coffee cravings. And I've been talking to a few people post, and a lot of them have maintained it. Like they haven't had a coffee this week, which is pretty cool.
Yeah.
And why do you even care? Like probably some people are thinking, well, I thought coffee was good for you. Like what's the big deal about cutting coffee out? The reason we cut coffee out is because it's giving your liver a bit of a break. So it is not bad. It's got high antioxidants, but it's good to have a break. And then it's also changes your energy completely. Why don't you talk about that?
I used to drink. I was drinking. Well, with my mask I wear at work now, I only get to drink one a day between patients, so it lasts me the entire day. But I was drinking 2 at least, and I didn't need it. Like it's funny when I go off coffee, it really super sucks for a day, and then I'm fine, and I go back to it every time, and I try to make up for the time I've missed by drinking more coffee, which is really dumb. But it's the ritual, the habit that you get stuck in. So I'm having dandy tea, which is not dandy. It's a misnomer. It should be called crappy tea.
No, it's really good. Don't listen to him. No, it's good. It's like a bitter taste, like coffee-ish.
No, it's not.
Okay. Well, it's a warm drink. So
I agree. I'll agree with that. It's warm.
A lot of people say...
but so's a hot toddy, and I can't take that to work either. So.
Well, it's funny because a lot of people say they don't need coffee, which I don't really believe. But anyways, a lot of people say they don't need coffee, that it's more of just the ritual of it. It's not. Because if you were having Dandy Blend, that's the ritual of the warm drink in the morning. But it's the kick. Like really, whether you realize it or not, the coffee is giving you an energetic kick. Yep. You just don't notice it because you've been drinking it for so long. But when you take it out, you will notice it.
I really wanted it this morning when I came into work for 6:30. Oh my God, I wanted that kick, but I didn't do it. So it's like I'm 10 days out now without coffee, and I'm still being pleasant to patients and my family.
You were bad, not
I
bad.
Hope. Anyway, but I do feel better, and you know what? The best part about cutting out sugar, as well as that you taste your food better. I find that actual fruit is sweeter. Everything's the flavor is much more better. Much more better. My grammar is much worse without caffeine, but it's much more better now. So I really like that component of it. Mm-hmm. I'm not doing it again for a while, and I'll slowly get all my habits back.
But we did hear from a bunch of people who wanted to do it, but the timing didn't work out, so we're actually going to offer it again.
Yeah.
And because it's been such a crazy year, we thought it's not a bad idea to run it again for anyone who's interested, but it's going to be even better. I like the timing better because what we're doing is the actual cleanse days are going to be Monday to Friday, and there's going to be like a celebratory fun drink and fun dinner at the end, and you don't have to go through the weekend at the end. The weekend prior is prep, so that's when you get rid of your caffeine addictions.
Because the cleanse is the worst on the weekend. Oh my God. All the things that I like to do on the weekend, even just have like a beer on a Friday when I get home from work making dinner, can't do that. And all the snacks I would normally have on a Friday night, I can't have. Mm-hmm. So it really made you eat a lot of grapes and apples and other things,
Mm-hmm.
which was good too. But that's the hardest part I found, was just changing your habits on the weekend.
Yeah.
So
Yeah. But it was good. We proved that you could do it. You can actually still have a fun summer when you're not having a coffee or a wine.
Saturday wasn't fun, but it was okay.
Yeah.
But it's the overall benefit of it is worth it. I would recommend it. I feel much better. The fact I haven't had to resort to coffee yet is pretty awesome.
Yeah, it's a testament. It's good to do one once in a while because it does take a little bit more work to get rid of the junk. So so watch for that. The event's not set up yet, but we'll let you know when it is.
I was going to talk about swimmers here. The fact that it's 40 degrees out, people are swimming. They're going to be swimming more. A lot of kids get swimmers here, and osteopathy can help with that. Basically, what happens is that the whole cranium moves. So cranial osteopathy, all the cranial bones move, and sometimes they get stuck. A lot of times, especially now that we're being somewhat more sedentary, or kids are on devices more, and they do that posture like this. They're sitting on their devices and looking like this. They actually can compress the base of their skull. So if the back of the skull, the base of the skull gets tight, the musculature in the base of the skull gets tight, it can actually affect how the cranial mobility is. So the actual temporal bone, the bone around the ear, actually rolls forward and back. And they roll both, there's a paired movement, they roll forward and back. And if that suture, the joint between the base of the skull and that particular bone are tight, it'll actually affect the eustachian tube that goes into the throat. Because it affects the mechanics of the ear, what will happen is that can get restricted and can clog. Kids that I've treated with swimmer's ear, or not swimmer's ear in general, but just having a clogged eustachian tube, if we can get the base of the skull to move and the temporal bone to actually roll back and forth again, it can start to free up that mobility and allow the fluid to drain. So one of the things that you should do if you have a kid who actually has,
or adult,
adults
get it too.
With swimmer's ear, posture is really important, right? Making sure your head's coming out of your neck, like make sure that the turtle head gets out of the shell. If you can stand taller, then it actually opens up your neck. What? It's a thing. It's a thing.
Okay.
I have many analogies.
Okay.
They all work. Also trying to open that side, so trying to stretch the connective tissue that comes down, because all these muscles come up and they attach to the mastoid process. This big sternocleidomastoid muscle. This comes up and attaches to the little mastoid portion of the temporal bone, so it actually pulls in the temporal bone and pulls it back this way. Also, if you can also stretch the big trapezius muscle comes into the base of the skull, so looking down towards your armpit to try to open that up. One other thing you can do also, if you grab your earlobe, if you pull it down on a 45-degree angle, you can grab both too, and it's really gentle. And what you're doing is you're pulling on the fascia that actually in the cranium to help take pressure off the eustachian tubes. So you're just pulling down gently on a 45-degree angle for like 10 seconds, but it's really gentle. Like don't do it like you're trying to pull start on a lawnmower. You'll get a really bad headache and it won't help at all, and you'll never do it again.
Yeah.
But if you can pull very gently, it can help alleviate that pressure as well.
Yeah, there are also some essential oils, like some quality essential oils that you can use around the ear. So you never want to put. I know I have a lot of clients who use them, who might be watching. So basil is a good one. Lavender is also good, but you'd want it to be diluted and never put it in the ear. Okay, you just put it topically, diluted around the ear, like all the way around the bones, and that can also have an effect. So the volatile compounds go in and they address what might be going on, and it can clear some of that fluid as well. And especially if there's an infection starting, because the essential oils, the basil and lavender, are antibacterial, and they can address a potential infection. So they work quite well as well. And then
volatile?
But they're volatile compounds.
Okay.
They evaporate into the air. They're essential oils.
Volatile just sounds like it's just
that like would explode.
Yeah.
Well, they're just tiny though.
Okay.
They do explode into the air in a tiny way.
It just sounds.
That's what they're called.
Painful.
That's why you dilute, because otherwise, if you're putting on your skin, they're gonna disappear into the air, right? So if you use a carrier, it's gonna go in your skin and do the work. So that's how that works.
Okay.
We've been doing this for 5 years. You didn't know that?
I don't listen.
Clearly not.
I get distracted by shiny objects.
Oh my God. And then what Dave was saying works for general ear infections too, right?
It can. Like obviously, it's your physician too. we had to make sure there isn't an active infection going on. Like, so you work with your doctor if you need antibiotics, you do need them. But I know with our son, Jake was like 9 months old,
Yeah.
and he had a really like the whole ear was red. It was like midnight. It was a freaking snowstorm, and so I did a technique that in pediatrics where you actually can drain eustachian tube. And I thought I felt it release, but of course he's screaming in my face. It's midnight. I've been sleeping, so I'm a disaster. And so I'm like, okay, I'm still going out to Shoppers. I'm going to get the Tylenol. And I went out to get it, and then I came back, and he was totally fine. It was crazy. He was happy. All the redness in the ear was gone, and he was like nothing had happened. So that was that was worth 7 years of school just for that evening, that I did not have to deal with a screaming child with an ear infection. Hey, Jen.
Yeah, not everyone is lucky enough to have a dad who is an osteopath. So, but if you can get through the night with some essential oils, in the meantime,
Scotch.
What else are you going to do? And then call us in the morning. We do take emergency clients, right? Sometimes.
Yeah, we always try to have spots where we can fit people in, but
yeah,
it's awful when you have that. Oh God, it's a trying time.
I do remember those times very well.
It's more of a blur for me.
Who's going to take tomorrow off? We'd always used to have this debate about whose day was more important the next day, so who could stay home. Well, sometimes I had to. Anyways, that was the stress of
yes, it was very
both
stressful.
Working anyway, outside of the home, the joys. I'm sure you can relate.
Other thing I just want to talk about was sciatica. Just people talking about sciatica, it drives me crazy because sciatica is a garbage bag term that's used in orthopedics, where any pain down the leg, oh, you got sciatica. Oh, you got sciatica. Oh, you're getting a surgery. It must mean you've got herniated discs in your back. It's a horrible thing. In 20 years of clinical practice, I've had 3 patients that had to go for surgery for back problems. The vast majority of patients, it's their sacroiliac joint that's stuck. So the joint between the pelvis and the sacrum in the lower back, if you put your hands in your lower back, you can feel like there's 2 dimples in your lower back. That joint getting stuck creates so many problems and so much dysfunction. Just like when people are shoveling and they get stuck and they go to shovel and they're bent forward and they can't get up, they're locked. Generally, it's their SI joint that's stuck. Mm-hmm. Like even when you get symptoms down the leg, there is a sciatic nerve and it can be affected. But generally, if the pelvis gets really stuck, then the lumbar spine, your lower back gets rotated, and then that can affect a nerve which goes down the leg. So, no 2 sciaticas are the same, because I love when patients come in and say, oh my God, my friend had this exact same problem.
I know, I told someone this the other day.
Oh, God.
I know it's hard not to, but I had sciatica when I was pregnant with my second. Do you remember that? Oh, it was torture. Yeah. It was torture, like the thought of walking. I remember the walking from my car to the Bronte pool was like a nightmare.
Yeah.
I just sympathize with people, but I remember you treated me like twice, and it was gone.
But that's different too, because of the relaxin hormone in your system and the fact that your ligaments are all lax, and then the pelvis has increased mobility. It's more prevalent to have pelvic problems and having pain in the leg when you're pregnant. Yeah. That makes perfect sense.
And older people too, right? Because I've had a bunch of friends say that their moms have it. Just recently, someone said their mom had it, but the mom was guessing she had it, but she was basically stopped doing anything, and she was an active person, and that to me is when it gets a bit sad, because she was hearing from other people that you can't treat sciatica.
Yeah, which is
can.
It's a load of something. I
can't
say.
Like I don't know where she was hearing that, but anyways.
And it's the funniest. Not the funniest thing. I guess the most interesting thing with sciatica is that it's for a lot of people it's a cumulative problem. You live in your pelvis, because you sit a lot. You fall, like you land on your butt. Like when you're walking, all the stress goes up your legs into your pelvis and lower back. So just having a small amount of restriction through the pelvis can have a large impact on the whole pelvis and lumbar spine. Or like an old ankle sprain that you had that it wasn't really serious, but it was serious enough that you compensated, and you're walking differently. Now you're loading your leg and pelvis differently, and then that affects the lower back too. Mm-hmm. I just hate hearing people say that, it's my lot in life and this is what I have to deal with, and that's it. And a lot of the times, the vast majority of times, it's not it. Like, we can generally help. There's some people we can't. Like, we can't fix everything. Sometimes over years of compensation, you've had structural changes to your spine where we can't fix it. Like, we can't fix osteoarthritis. If you have severe osteoarthritis in a knee, for example, we can't fix it. But what we can do is we get the foot to move, the ankle to move, and then we get the pelvis to move as well, so that there's less load on the knee. You try to make, wherever there's a problem, you can make everything around it move well from the foot up. It's amazing the difference it can have in people. Like, I've had a lot of patients of mine, seniors, that they thought that they would be stuck not moving, like they couldn't move anymore, they couldn't go out, they couldn't be active, and now they are.
Yeah.
But like I said, vast majority of people, you can make a difference. Even we treat you a couple times, and if you stretch and you become more active, because sedentary lifestyle is another huge factor in pain. We're meant to move. We're not meant to rest. Like, especially in COVID times, sedentary lifestyle is killing people.
Plus inflammation, because let's face it, people are drinking more. They just are. We've seen the LCBO stats, and
the lines.
So your inflammation is on an all-time high, and so when you've got
stress and
bad diet, like even stress causes inflammation in the body and everything, and so that can exacerbate the problem. And anyways, so there's always an answer, is basically what we're sort of saying, right? Like, never take no, you can't fix that as an answer. Keep looking.
Just search out answers, because a lot of times there is an answer. Sometimes, unfortunately, things can't be fixed. Like when a joint is falling apart, like you have severe osteoarthritis of the knee, you need a new knee.
Or like frozen shoulder.
Yeah, frozen shoulder.
Frozen shoulder is one.
It runs its course. It's super hard to treat, but you have to keep it moving. But eventually, it will get better.
Yeah.
But it's odd. It's one of the oddest things I've ever seen, is frozen shoulder.
Yeah, I know that is weird.
There doesn't even have to be a mechanism of injury. One day you wake up and your shoulder's not moving very well, and it just progresses.
But like you said, it's accumulation of a certain thing, right?
For frozen shoulder, it doesn't even have to be.
No.
It's usually, unfortunately, for women, it's around menopause.
Oh, right. Yes.
And that seems to be the greatest. I know, another kick in the teeth.
Toes and shoulders.
Oh yeah,
what's up with that?
Lynn had a toe problem.
Every time I have a problem, he says it's menopause.
No, I say it's because you're old.
Well,
Lynn will come up with a problem, and I'm like, oh, I read a study about that. She goes, did you really? I go, yeah. It happens in old people.
It's perimenopause.
Yeah.
I'm not in menopause yet.
No, I'm not saying you are, but I mean, it's just funny because I keep saying the same joke and you keep setting me up every time.
But there is a toe thing, right?
Yeah, the ball of the first toe, so that your big toe, there is a correlation with menopause. And if you can't extend your toe, if you can't bring it up, for some reason the little tiny muscles in the bottom of the great toe get really short. And I did a course in Montreal with an osteopath from Vermont, like an osteopathic physician, and that's what he said. He goes, I don't know why, but all my perimenopausal women, they all get this. And
super weird.
It's true. It's unbelievable how many women I've had to work on their toe. They're all stuck.
Yeah.
And then if your big toe can't move when you walk, it affects your ankle, knee, hip. It's crazy.
Yeah. Yeah. Oh, you know what I wanted to mention?
I don't. Tell me.
I know we've talked a lot about the cleanse, but not everyone's into a cleanse. But what I wanted to make sure you knew was that we actually are doing more custom designed menu plans for people if you're looking. And I was just sort of looking through some of the ones I've done, and allergies are crazy for people this year. And actually, I've got a really good menu plan for antihistamine diet. So believe it or not, the foods you eat can impact how your symptoms feel with your allergies, and focusing on antihistamine foods can be really helpful. So if that's something that interests you, and it's not just allergies, like I've got a ton of different things I can help with. If that piques your interest, just make sure you let us know as well, because we can custom design things for you. You don't have to do the full-on cleanse. Do you want to talk about the exercise thing?
Sure. So what we're looking at, we're trying to decide what could help people with fulfilling their exercise obligations to therapy. It's amazing how many patients I have that come back and I ask if they've done their exercises. They say yes, and then I just stare at them, and they're like, no. And because they know I'm going to check them, and they're going to know. It's like going to the dentist, right? Did you floss? Of course I did. And, your gums are bleeding because you've been flossing like crazy for the last day to try to get all the plaque out of your mouth. And they know you're lying, right? So we're trying to decide what would help people
maintain.
follow through and
be
get
accountable.
Yeah.
Be more accountable to the exercises.
Yeah, because the exercises we don't give them is just a time waster and trying to see how much of your life I can control outside of these
But
walls.
they're super boring.
Yeah, they're super boring.
They are. They're super boring.
Well,
And
you can play music then when you're doing them. I don't really care.
I know, but
Sing a
like,
song in
the
your
thing
head.
is, like, you'd way rather do a class. Like, I would way rather do a bar class than the boring exercises that I get from this guy.
The same woman who tells me when I treat her that I'm doing it wrong. 20 years of therapy.
I'm like a typical client.
No, you're not.
That's why I'm sharing this, because I'm like your typical.
No one tells me I'm not doing my job well.
Oh, I never.
You're like, it's wrong. You're not doing this right. I think you need to treat this. I'm like, could I just?
So we have a term in our house called Ellicized.
No, it's not true. Anyway,
that's when the story gets a bit
let's
big.
not have this on camera. This is
Excuse us while we have our domestic. Anyways, the program.
So we're going to send out a survey, and we're just going to see if you would be interested in having the ability to have someone online in Zoom format take you through your exercises, just so that you can actually get them done, schedule a time, and just, even if it's 10, 15 minutes, you can walk through them with someone, or you can ask questions of your exercises, and just have that ability.
And have them watch your structure to make sure you're holding the positions right, that kind of thing. So I think sometimes people forget too.
Yes.
They leave with the instructions, and then they, oh shoot, wasn't I doing it right?
Even though you can always call them, we can tell you over the phone what's going on, which we always say, make sure you understand your exercise, but no one does. And then they come, oh, actually, no, somehow.
Well, no, sometimes people are visual learners, right? And so they just need to see someone do it for them again. So
yeah. So anyway,
be part of it. I don't know, but
we're sending out a survey about that to see if anyone would be interested in that.
Yeah. So we're going to post it here in our Facebook group. So if you want to fill out that survey, that would be awesome to get your feedback. So you want to design it in the right way that's going to meet your needs. So.
Yeah. So besides that, I'm happy no one's on a cleanse because it's a gorgeous day outside. It's Friday, so have a wonderful weekend. Enjoy your backyards or wherever else you're going to do, patios.
Yay.
And restaurants in some areas are open, so yeah, enjoy.
Yeah, have fun.
All right.
Chat soon. See you next week.